Welcome in, everyone. An exciting Tiny webinar for you. Thanks so much for being here early, signing in. I hope you all say hello to me on Twitter. Give me that shout out at Andrew Sumitani, or comment on our event at LinkedIn. I'd love to hear from you, hear your thoughts. And it's always cool to hear folks' experiences and know that they're sharing their learnings. Love to give you that virtual fist bump. Welcome in. We've got folks literally coming in from all over the world. We have guests from South Africa. Welcome, welcome. We've also had some visitors from the Netherlands as well. Welcome. Thanks for being here late, your time. We'll get started here in just another couple of minutes, folks. Super exciting program for you today. Got lots of folks streaming in. Welcome, welcome. Hello, Michelle. I see it. I love your message. Use that Q&A box. San Antonio, Texas. David News from Texas. That's awesome. All right, we'll give another 30 seconds. Got lots of folks streaming in, logging in. Get your water, your tea, your coffee, other beverage, depending on where in the world you're coming from. This tiny community is just amazing. Drop those questions in the Q&A box today, folks. We'll get started here. Just another couple seconds. I see a lot of folks still coming in. All right, and if you can't make the entire thing, we will send a recording, but I encourage you to stay for the entire thing. Our Q&A sessions tend to be the most electrifying and where our speakers get the most energy, and where we find out how to program future Tiny webinars. All right. We'll go ahead and get started. Hello, everyone, and welcome back to Tiny Webinars. We have a packed house today. I can't believe it. Bringing employees back to work is top of mind for leaders everywhere. We'll jump into that in just a second. Join us next week. I'm bringing an expert on mindfulness and programs and how you can look after your team's mental health and well-being. Super important right now. I was just reading Tim Ferriss's book, Tools of Titan, where he interviews insanely successful people from artists to billionaires. Turns out 80% of them practice some kind of meditation or mindfulness training. So Mary Pigatti, CEO of Be Mindful, is joining me. She's going to share how you can take away some of the same benefits, not only for yourself as a leader, or an HR pro, or VP, or director, if you have a team, but also share that with your employees. That's super important for building those bridges, especially if you have new hires. It's a super important topic. Later in May, Dr. Laura Voiles is joining me as a series regular. We're starting up some tiny live sessions. Haven't finalized the name on that one. We'll try that on. We're going to mash up all the topics in leadership, culture, and employee engagement, all in a live Q&A format. I highly encourage you to join. Search Tiny Pulse on LinkedIn and follow us for all of the invites. All right, keep up, everybody. I got some quick tips for you. Housekeeping today. We're going to use that Q&A box. Use that menu bar on the bottom of your screen to enter your questions for Dr. Voiles and David. Vote up and down so I know what you want answered the most. Code for your SHRM pros in the audience today will get dropped at the end. And again, the recording will be available after. I'll send it to you so you can share that with your colleagues and have a meaningful discussion. I think that's the most important thing. Loop me in, dear Andrew at tinypulse.com. I'd be happy to share more in that discussion. Do not forget to take that post-session survey. It really does help us create the right content, respond, have enough time for Q&A. All right, on to our episode. Dr. Alora Voiles joins us from Southern Illinois University, Edwardsville, powerhouse member of the faculty, assistant professor of industrial organizational psychology. Her work is widely cited in psychology and industrial science journals. I also brought back Tiny Pulse founder and CEO David New, who partnered with Dr. Voiles to conduct and analyze the research we'll cover today. So David, I'm going to have you take it away because I know you have a lot of thoughts on this topic as a founder and a CEO. Kick it off for us.
Thank you, Andrew. So first of all, delighted to be here. And one of the things I did want to highlight before I just jump in is that, as the attendees here are, usually tasked with managing and inspiring their team, their company, their employees. But I think, what I've learned in the past year is more so than ever, your plates have been overflowing with other demands that COVID has put, be it childcare, elderly care, your employees, your people, mental health, well-being. So there's just been so much that probably the C-suite's looking at you, your employees are looking up for you, and then also your peer group. So, I just wanted to say that you folks, you people leaders are also some of the heroes out there in terms of guiding your employees and your organization through this whole process. So I just wanted to publicly just acknowledge that to everyone in the audience today, because I know it's not easy. And then, one of the things that makes me so excited about this topic today is that overnight with COVID, we all were kind of in a level playing field, at least here in the US, where, everyone kind of just shut down. But this return to work is much, much trickier, right? You have some companies already saying, we just got rid of our lease. We're not having an office, so we're all going to be remote. You have others that said, we're all coming back, and they've already started coming back. And then you've got all stripes and variations in the middle. In fact, our research says about 39 to 40% of people, they don't even know what their policy should be. So that's why I think this Tiny webinar is just so important. And we're delighted to be able to partner with Dr. Voiles, PhD and IO psychologist about this. And I'm excited to learn from her and from the community as well. So please add your questions in the comments and vote them up as we go through this presentation. So with that, I'll pass it over to the expert, Dr. Voiles, please.
Thank you, and welcome. We're so pleased to have you. And throughout this presentation, we'll have polls for you to respond to, just so we can compare your responses to the survey responses that we received. So here's the survey that we conducted. We accessed managers and human resources managers through email, LinkedIn, professional networking sites. We got over 400 responses, and we collected all of those during February. The organizations were diverse, so there were a variety of industries represented, as you can see on the right-hand pie chart. Some of our kind of bigger industries that we had accounted for were like computers and technology, as well as like professional consulting and government and nonprofit. The organization size ranged widely. There were huge multinational organizations and then very small organizations represented as well. In terms of our actual respondents, we had a majority of women, so about 75% of women, and then we had about 21% of men. And then in terms of race, it was primarily white or Caucasian, but then there was a good slice that was about 25% making up, multiracial, Asian, Black or African. And another big piece that I want to include here is the geography. And I think this is one of the really powerful aspects of this project that we kind of pursued. We surveyed HR managers and managers from over 45 countries, with the majority of them being from the United States, but here we've gotten a worldwide response in terms of how organizations have responded to the pandemic and how it has affected their day-to-day operations.
And while you're transitioning, Andrew, if you could send the first poll question right on cue. Thank you.
And while you're responding to that first poll question, here's just a quick preview of what we'll be going through during this presentation. We found 6 main themes in our data. We found, for one, that there was a resilient response to COVID-19. We'll get into that some more on the next set of slides. There was also a price to pay, and that was the impact of stress and the impact on emotional well-being. We're going to talk about the goods, which I think are really relevant to you right now, which is that return to work policy, as well as changes to in-office policies, vaccine policies, and then finally looking forward, the HR priorities for 2021. So this will be our roadmap, and this will guide us between each of the sections that we go through. All right, so one of the big wins that we have found from this pandemic or during this pandemic was that HR leaders overwhelmingly agreed that their organization responded well during the pandemic. In fact, 90% of them strongly agreed or agreed to the statement that they had responded well. And this highlights the resilience of organizations and HR managers like you. So not only managing just the day-to-day operations, but then suddenly making switches either to fully work from home, changing employee schedules, accommodating spousal and childcare needs and kind of responsibilities that employees are and you are facing, as well as the challenges just in terms of complying with COVID policies to keep everyone safe. So this really shows and speaks to the agility that HR managers, organizations, and employees have shown during this pandemic. I think that looking back in March, I think many people would have underestimated how effectively they were able to handle this quick change. And just quickly, here are the results. David, do you want to go through the results of the poll?
Yeah, so in the survey that we conducted, it was 90%, and looking at this is 40, almost look what 85%. So very in line. And I would have to say, when we first saw that, and when I was reviewing the raw data with you, Dr. Voles, that I was a little bit shocked and taken aback at how high it was. Were you as shocked, or does this surprise you at all?
I honestly didn't know what to expect. And I think that speaks to the uncertain nature of the pandemic. This is uncharted territory for everyone. And going forward, it's still uncharted territory as far as returning to the office. And it was uncharted territory back then as far as switching policies and work from home. So I didn't know what to expect.
Great.
Okay, so work from home was rated as extremely successful. In fact, we looked at work from home success in primarily English-speaking countries, and we found that the UK rated the highest in their perceived work from home success. New Zealand was a little bit lower, and this may be because maybe they weren't all working from home or they didn't have to as much because of the quick response in their government. However, we didn't find a significant difference by country. So there was kind of a little bit of variance here in the amount of success. However, overall, all of these countries and really largely our responses as a whole indicated a lot of success in terms of switching to remote from home or work from home.
Yeah, and I would say that that was one of the reasons that I think really surprised me, and at least I told you about my that I didn't expect that. So that's why part of the loop at the very beginning is I said hats off to folks on these calls. These people leaders were the ones, the backbone who enabled that successful transition, and that wasn't easy, and because there's no playbook for that. But I thought that was a great way to start in terms of highlighting the resiliency of these people leaders and their organizations.
Absolutely, yeah. These charts here just indicate how successful it was in terms of navigating a worldwide pandemic and then switching to work from home. And then in some separate data, separate research, it's been found that a lot of organizations have not reported a decrease in productivity during this work from home, which is pretty amazing and again speaks to that resilience. However, that resilience is not without a cost, especially during a pandemic. So there has been an impact in terms of stress on employees and HR managers. We found that in terms of HR managers' opinions of how the pandemic has affected their employees, they found, or they reported that emotional exhaustion was the #1 highest rated. So they found that employees were indicating that they were feeling emotionally exhausted. There was also reduced work-life balance, or sorry, reduced engagement, which is not surprising given the stress that can come from making a quick work from home kind of switch and then dealing with a lot of outside things. And then finally, reduced work-life balance. With working from home, there's more of an integration where people have children running in during their work meetings, and then they have to respond to work emails later on in the evening. And so it's kind of made the days not quite as clear boundaries in terms of work and home life. There were some areas that were not so impacted. So organizational commitment was not impacted. And this is probably largely due to the fact of the uncertain job market at the time, especially kind of early in the pandemic. A lot of companies stopped hiring. So they froze those hiring and canceled their job postings. And so people were feeling probably more committed because there's uncertainty about being able to get jobs. David will speak to this later, but there may be a bit of a kind of jump that happens as we come out of the pandemic where employees may be thinking about leaving once they are more able to. They also reported very little difficulty with adjusting to remote work, which is amazing given the rapid change. And then also they didn't experience negative perceptions of HR, so that was really low as well. So overall, there is a price, which has been kind of emotional exhaustion and this kind of reduced engagement that HR leaders will want to consider. One thing that we looked at, and this really speaks to the power of HR managers and managers, is how they helped to reduce the negative impact of the pandemic. So it's a worldwide pandemic, and specifically what they did to support their employees. And we found that flexibility and support were the two biggest open-ended responses. These included things like giving employees flexible hours. It included sometimes, for example, like financial support for work from home supplies. It included listening sessions for employees or having managers check in with employees. And then the top two rated was protection to control the spread of COVID-19. So these were the two biggest. All of the others were much smaller compared to these two kind of pillars of stability that HR managers provided. So, you know, if you have the opportunity to drop it in the chat, it'd be interesting to hear if we have at the end of the session time to kind of discuss how you supported your employees and how you helped kind of reduce that negative impact during the pandemic. One thing kind of going forward is it may be important to continue these flexibility and support policies just to help with employees as they're transitioning to more in-person work or going through different protocols. This will help support them in terms of balancing childcare and other responsibilities that they're dealing with. Okay, one of the big prices of the pandemic has been higher stress levels. And we asked about HR leaders' own stress levels. So they reported their levels of stress, and they did report that they were experiencing higher levels of stress. They also indicated that managers in the organizations were experiencing higher stress as well. And so specifically that they were 14% more likely to have those high stress levels. And oh, sorry, my cat. Looking, he wants to be in the presentation too. Looking at your results, though, it looks like there's been some higher levels of stress as well. David, do you want to cover the results?
Yeah, it looks like 65 or 2/3 of you folks agree that during the pandemic, you've had higher levels of stress. And 17, you know, the 1 in 7 thought it was a little bit lower. And, you know, about the other 18% felt it was like, you know, a little bit higher, basically right in the middle. So it does look like, you know, the folks here on the call, you know, at least 2 out of 3 felt higher levels of stress.
Yeah, and so it's important also to consider kind of what the sources of stress are for you and make sure that you're taking the opportunity to be able to address that stress as well. So if you have PTO or other kind of opportunities to reduce your stress, that's highly recommended. Okay. There was also and impact more directly from the pandemic. So I analyzed data on the COVID-19 reported cases and reported cases of COVID-19 deaths in the specific countries where these respondents were located. So each person who responded to it, we looked up their country and looked up the COVID-19 cases and deaths. We found that there was a significant correlation with people reporting more stress when there were higher levels of the cases and the deaths, and then also higher levels of employee emotional exhaustion as well. And so this speaks to that really kind of powerful undercurrent of stress that has been caused by the pandemic and the kind of obstacles that we have faced worldwide. One of the interesting things we found that we didn't quite know what to make of was that this correlation was especially strong for IT consulting industry. We guessed that it may be due to the fact that so many countries were, or so many organizations were switching to more online work from home, and that IT consulting was needed in order to support that, and that's why they would have more of a high correlation between these things. But that's just our theory working right now. There's no way to kind of determine exactly what the cause was, but that was interesting. And we didn't find that level of strength for medical workers, for example, which is what we expected to find. So it was very surprising. It could be with medical workers, though, that they expect to have to be on the front lines and expect to experience this type of stress. Okay, so now that we've covered the resilience and the impact of stress and well-being from the pandemic, now we're going to turn to that return to work approach. And this is really going to help kind of advise you, and you can see what other organizations are doing, as well as how other HR managers responded. So surprisingly, we found that not that many actually rated return to work as a really high priority. So only 37% of them rated it as a high priority. And we suspect this has actually not been prioritized for a lot of organizations because organizations have responded so well during the pandemic, and work from home has been extremely successful as well. And so if it's kind of the idea, like if it's not broken, you know, don't try to fix it, and things are going okay right now, so they may not be in a hurry to change things up yet. And so one of the questions we followed up with is what you think it'll look like after the pandemic is over. So after the pandemic is over, I expect things in my organization to go back to normal. And this was interesting because the responses were all across the board. There was no kind of huge majority. The biggest majority we have is just disagree, which is 38.1%. So there is a pretty big split in terms of, you know, 46% of them disagree or strongly disagree, which indicates that they think that the landscape of work will be forever changed from this pandemic. Likely with work from home, it could be additional kind of safety factors put into place. But it could be that specifically with the success of work from home, many organizations have realized that they can offer this as an additional benefit or an additional place of flexibility for their employees. Okay, and now I'll let David go over the poll that you just saw about your ability to formulate a return to work plan.
Yeah. So first question is, you know, how confident are you in your ability to formulate a return to work plan? And it looks like confidence is super confident, and we have a plan is 52%. So that's basically half. 25% are neutral, and the other 25% are struggling or not as confident currently right now. And then the second part of that poll is, if your organization has been working from home, what's your policy? And the vast leader, 2/3, is a mix of virtual and in-person. 15% don't have a formal policy. 12% work as normal. It looks like back in the office. And then 6% are, getting rid of the office space. So yeah, so it feels very interesting. I think that to the first part, to what you were talking about earlier, Dr. Voiles, is because I think 90% people thought they've responded effectively to the pandemic, and their working from home policy is doing well. Perhaps that's why they have a lot of confidence moving forward in implementing a return to work strategy. But yet at the same time, I think our research is about 39–40% don't have it. And we're going to give you folks data points as to, well, for the 60% who actually do have something, what does that breakdown look like? Is it 1 day a week, 2 days, 3 days, 4 days, or so forth? So I'm excited to dive into that area as well.
Yeah, I also think it's really interesting that such a large majority is going towards that mix of virtual and in person. It seems clear that they are kind of looking to have that flexibility in case the pandemic situation changes. But yes, when we conducted the survey, there were almost 39% of our HR leaders did not yet have a formal policy. And we'll kind of move forward to show you, for those who did have a policy, what their policies looked like. So the most popular was actually having 3 days a week in person and then using the rest for remote work. For those, the next kind of popular were 2 days a week or 4 days a week. And then they also kind of had an unspecified remote office category, which often, so one of the examples was like an organization would have different teams that rotate in each week, for example. And then one of the less popular ones was also just 1 day a week. So if you're still undecided, it's easier to kind of remove days in terms of the office requirements rather than adding days. So you could kind of start out with, let's say you want to aim to have 4 days, go ahead and start with 4 days. And if the pandemic situation changes or if employees need flexibility, that's where you can kind of bump it down to 3 days a week or 2 days a week, or doing some combination of that kind of remote that works for you and your employees. So it can be very much kind of fit to roles as well. So a lot of organizations do it depending on the role.
Yeah, and I would just chime in, Dr. Voiles, is that I think that's excellent advice, and I think it's what's just critical is just always have the pulse of how your people are feeling, right? Like either talking to them or surveying them or whatever mechanism you have in Slack or Teams, but just understand how they're feeling about it, because there could be some initial excitement and then that might wear off, and then they might want to go into a different rhythm as well. So just at least at Tiny Pulse, we're also very candid. It's like, this is our policy going forward, and we're going to reevaluate on a consistent basis as things unfold, and obviously update you folks. And what will happen probably in 3 months and 6 months is probably going to be different than what it is today. But also kind of setting that expectation that we're always going to be a little bit more conservative probably, and err on safety and flexibility for the team.
Yeah, I would agree completely. And just having those kind of frequent pulses or surveys can help with agility. So for example, if you find that some employees are hesitant to return to the office, you might dig into the reasons why through like a quick survey or a pulse. And if, for example, it's concerns about childcare, then you can kind of work on having a kind of flexible policy that allows people to balance childcare and their work. Or if it's concerns about, for example, COVID-19, you can have policies in place to help keep employees more safe and socially distanced. So it allows you to kind of be a little more flexible and tailor your efforts rather than just kind of guessing how employees are feeling or why they might be hesitant. So here are some examples of office policy plans from some companies that we're all familiar with. So for a company that is returning completely to the office, Amazon plans to be fully in person by fall 2021. And we have a statement kind of from Amazon just showing that they feel that it helps with collaborating and working together. And employees kind of are maybe a little more hesitant when they would express kind of that they want to work from home a little bit more. For Ford, they're doing a hybrid approach. So they've kind of learned that they should kind of wait to see what employees need, and they will kind of have those flexible hours for their salaried office employees. Now, as I'm sure you're aware, like in manufacturing, that's not quite the same as in terms of options for work from home. And then a company that has made the permanent work from home policy is Spotify, and they've kind of indicated that they have a work from anywhere policy after the pandemic, and that they want to offer that flexibility to their employees, but also have a place where they can meet and kind of collaborate as well. So these are just some examples. There are a lot of other examples available as well, and if you're interested, we can discuss it more in the Q&A. All right, now moving on to kind of these changes in office policies due to COVID-19. So a lot of this is related to kind of the safety of the office. One of our big questions was, after the pandemic, how much do you think your organization will engage in these kind of COVID-19 safety practices? And the biggest one was frequent hand washing. We also found that work from home is another one. And then it kind of falls off from there with distancing, reduced capacity, mask wearing was pretty low, and then symptom questionnaires and temperature. It's not surprising that those two were kind of the lowest because those are a little bit more of a burden put on the organization in terms of administering those things to employees. But these are examples of some of the post-pandemic plans in order to keep employees safe, and what other organizations are currently doing. We also found that there were some interesting differences in terms of mask wearing after COVID-19 is no longer a major threat. South Africa, our respondents from South Africa reported that they were especially likely to continue wearing masks. However, respondents from Australia and New Zealand, which were countries that really successfully controlled the pandemic, reported that they were the least likely to wear masks. And this is likely because they just didn't see the necessity if it's well controlled in their country. Okay, and now we're getting into the vaccine policy and the willingness of employees to have the vaccine. More than half of our HR leaders that we surveyed reported that the COVID-19 vaccine policy is not a priority or a low priority. And I have to be honest, this surprised me actually. I thought that they would actually at least put forth a policy or kind of want to put forth a policy, even if it wasn't mandated. We did find that certain industries were significantly more likely to endorse this as a high priority. So the industry, energy industry, hospitality and service industry, as well as medicine and health. These indicated that, for these industries, they needed a vaccine policy because they are more customer facing and they have a higher likelihood of getting COVID-19. Okay, it looks like our poll results are in. David, you want to go through those?
Yeah, so we asked about which of the following responses best describes your willingness to get the COVID-19 vaccine. And of course, you can say if you don't want to share, and that was 2%, would prefer not to share. But the overwhelming 80%, 8 out of 10 said that I have the vaccine. And then it's just a very small breakdown thereafter. Is 8% said I will not get the vaccine, 6% says I want it, but I haven't signed up, and another 4% said that I'm in line to get it. So it looks like if you add the 80, the 6, and the 4, almost 90% either have it or look like they're about to get it, hopefully shortly when it becomes available.
Yeah, that's interesting. And that, from what I know about the current national average in the United States, that's higher than what it is right now.
Yeah.
So it's good that that's been available.
Yeah, I think it dovetails nicely with the next slide, right?
Yes, yes. So we had an interesting set of questions. We were curious about employees' willingness, so the HR leaders' willingness to get the vaccine for 3 different types of reasons. 1, to return to the office, 2, to keep their job, and then 3, to go on vacation. And these results were surprising. We had a reported higher willingness to get the vaccine in order to go on vacation. And so 61% of them said that they would do it to keep their job, 59% to return to the office, but it was almost 70% that would do it if it was required to get on, to go on to a vacation. We didn't find any differences in terms of race and vaccine motivation. This has been discussed a little bit in the press, but we did not find it in our research. And then we also found that for HR managers experiencing stress, they indicated a higher willingness to get the vaccine in order to return to the office. And this is likely because the work from home has added stress for HR managers in terms of trying to coordinate efforts, come up with new policies, and returning to the office may be kind of a reprieve for them. So these are interesting results, and we were surprised that the vacation is such a huge motivator, and it may speak to how a lot of employees and HR leaders are feeling tired from the pandemic, and also a lot of people have not been using their PTO because I think they've taken the perspective of, I can't go anywhere, why would I use it? And so it speaks to that kind of desire to get back to normal and take a vacation.
Yeah, and I think it'll also foreshadow is that in your organization, if getting the vaccine is a priority, there's always the balance between the stick and the carrot approach. I think this highlights that the carrot could be a much more effective approach, and I think you'll share some examples on the next slide.
Absolutely. So some of the biggest recommendations from SHRM, as well as what other companies are doing, involve really offering incentives as well as education and convenience in order to help encourage employees to get the vaccine. So in terms of incentives, it's giving PTO, it's giving employees maybe small amounts of bonus pay in order to kind of reward them for being willing to get the vaccine. And then in terms of education, it's kind of rolling out additional information and encouraging those benefits for employees to see. And then finally, convenience. A lot of organizations are offering on-site vaccines, and they are also offering mobile clinics as well. So they're trying to make it easy, and they're trying to educate about the safety of the vaccine as well as providing incentives. One thing to kind of be aware of as a company, if you are, and not many organizations are considering this, but if you are considering mandating, you do have to take into account the equal employment opportunity in terms of disability. Some people may not be able to get the vaccine based on health conditions, and then there are also religious concerns as well. So some people may have legitimate religious concerns that would make it so that they would not want to get the vaccine. And so you need to be aware of that and kind of seek your legal counsel in order to get guidance on handling that as an organization. Okay, for the final set, we want to look forward into how our HR priorities are shaping up for 2021. So first, we'll give you a poll about your top 3 priorities for human resources. This has been a unique year, and we want to hear how you plan to move forward. So I'll give you a moment to respond, but here we have our top responses for human resources.
And I think one of the things that you and I were talking about when we were combing through the data is that the vaccine policy was at the very bottom of that list, and engagement, manager effectiveness, and recognition, employee mental health and safety were the top 5, and everything else is kind of sandwiched in between. Were you surprised that the vaccine policy was that low?
I was, yes. Looking at the other section of the data, though, where we found that the highest concern was employee emotional exhaustion, that really fits in with these top priorities of engagement, manager effectiveness, recognition, and employee mental health. If those things are done well, that can help reduce that employee emotional exhaustion. So knowing what we know now, it makes sense, but it is surprising. Were you surprised?
Yes, I was.
I was too. Yeah, and I'm curious, during our Q&A session, if the audience was surprised as well. This is not something that we saw coming. I thought vaccine policy would be right up there at the top.
Mhm.
Oh, it
All
looks like
right.
our poll results are in.
Okay, well, I'll take a quick look, and of course, you had 3 votes. So it's not going to add exactly up to 100, but the biggest one right now is returning to work after COVID, right? So this survey, someone asked about the sample size, over 400 organizations around the world. This was conducted in mid to late February of this year. So returning to work is #1 with 61% of people voting that as their top 3. The next one, number two is employee engagement at 52%. And then there's 3 others that are clustered around 40, which are D&I, social justice, employee mental health, safety, and then the third one's talent acquisition and retention. Anything that jumps out at you when you look at the live results versus the research?
Yes, actually, I think it just speaks to how quickly things are changing during the COVID-19 pandemic. If you look at our results, return to work is way down. Is that number 8? Here, 1, 2,
Yeah,
6,
4
7.
from the bottom, yeah.
Yeah. Um, it's way down on the priority list, but here it's a pretty obvious front runner. And then the social justice as well, that was kind of middle of the pack before, but now it's jumped up as well. So I think there's definitely been a shuffling of priorities, and that speaks to how difficult it is for HR leaders and organizational leaders this year, because of evolving situations, these priorities are going to be changing very frequently. Whereas when we administered the survey, a lot of organizations, I think, were kind of in a holding pattern of working from home,
Yeah.
so that engagement, manager effectiveness recognition, and employee mental health were really important because everyone's off by themselves, working kind of separate from the organization from their homes.
Yeah.
But now we're thinking of, working more in person.
Yeah, and I think it also speaks to what you alluded to earlier about the importance of getting the continuous kind of feel and pulse of how the team is doing, because I do think they will change as well if HR leaders are sharing this, 60 days later, 50 days later than their initial poll, then I would have to imagine that the team's feelings and point of view could fluctuate equally as quickly.
Absolutely. And it's not an exaggeration to say that it's more important than ever to survey employees and to determine how they're feeling right now, because of how quickly things are changing, and also because there are so many different kind of factors that are going on right now in terms of, vaccine availability, the return to work plans, the current economy, just so many concerns. So we've kind of determined that these were the top priorities then, but this is likely to change. And I would guess that if we did this again, which we will be doing a follow-up survey to this, I would guess that we'll have different priorities in the top place. We wanted to look closer at employee mental health. This has been kind of a topic that a lot of HR leaders have really focused in on, especially during the pandemic. We found that during the pandemic, there was quite a lot of reporting of employees experiencing emotional exhaustion, as we mentioned before. And then we found that the prioritization of employee mental health was actually not correlated, though, which is interesting. So this is HR managers saying our employees are emotionally exhausted, they're having a hard time, but we're not able to prioritize mental health. We have to prioritize other things over that right now. So I think that speaks to kind of just the difficulty in terms of time and resources and being able to address all of the concerns that are currently going on. And then for our final kind of investigation on this priority, we looked into diversity, equity, and inclusion. And we asked HR managers about whether their organization has room for improvement in DE&I. And we found that, not surprisingly, over 75% of them agreed they have room for improvement. And then we also found that there was a significant percentage of them. Oh, sorry. Oops, hold on. There we go. There was a significant percentage of them, so 63% of them agreeing that the D&I or DE&I was a significant part of their organization plans for the future. And we found that there was a correlation. So organizations that recognized that they had a high room for improvement in terms of DE&I also were more likely to focus on DE&I in the coming year, or at least state that that was one of their high priorities. So having that awareness and kind of being kind of cognizant of how diversity, equity, and inclusion is going in your organization can help power those plans and that need to focus on DE&I.
Great. So now, before we jump into the Q&A portion, I'm glad we have a lot of time because there's like 17 questions in there, so it's rich and robust. Please feel free to add your questions or vote up, and I'll moderate that. But one thing that I do know is even for us, like we're returning to work, we're doing our return to work survey right now. It's hard. And we have a lot of clients and prospects asking us for that. So we have what we call a return to work professional services package that we layer on top of what we do on the pulsing and the larger surveys. So this strategy acceleration, if you're interested in, if you're a current customer, let us know and we can provide you a custom quote on that based upon your size and your needs. Or if you are a new customer that signs up before June 1, since most of this work is happening right now. And I think that you just have to opt into the Zoom chat and chat insiders to Andrew at TINYwebinars. But, I think it's around, you can bring in, if you're the CEO or you want to bring in your CEO, she or he can join as well, learn how to customize the questions. Like we're getting RFPs and people are just afraid like, oh, are these the right questions to ask? Is this like leading them on, minimizing pushback since you have an independent third party to help you co-pilot that. So with that being said, I just wanted to put that out there as an option if that is of interest, but we're going to return right back to the webinar. And the first question is, okay, so there's a one from Maria, thank you, about some engagement ideas and activities that others have done remotely. So I think we'll do a separate Tiny webinar just on that because I think there's so many great ones and I've done an interview on that in the past. So we'll we'll table that for right now and focus on the return to work for a little bit. But thank you, Maria, and everyone else who's responded to that. So how do you enforce these policies when many organizations begin hiring from out of state? They have some employees that cannot come into the office weekly. How do you see that type of policy keeping with equity across the organization? And before I throw that to Dr. Voiles, I'll say that is certainly a consideration for us at Tiny Pulse. Is because of the pandemic, we're all working remotely. We started hiring people outside of, we're here in Seattle, Washington, outside of Seattle, Washington. And, that's a huge consideration. Like, these people physically aren't going to be flying in every week to the office. So that leads us to lean into the side of having much more flexibility and optionality. So if you don't want to come in or you don't feel comfortable, that's fine. But then probably once a quarter, we would like to have different groups fly in so that they can have some of that face-to-face interactions. But any thoughts on that, Dr. Voiles?
Yes, I think this has been a concern, especially even if you think about the day-to-day interactions. There can be some kind of inequity in terms of having Zoom meetings mixed with in-person meetings. So when you have a group of people who can meet in person and then you have like other people Zooming in, basically, they may not be as included in those meetings. Some suggestions that have been made in terms of like HR and managing this is that when there is a meeting where people have to be Zoomed in, that they actually have everyone at their individual computers and do it fully remote in that case to keep it equitable. Yeah, there's a lot of concern, and I think your perspective in terms of offering that flexibility to employees who do work on site in the location makes it more equitable as well.
Yeah, and I think it's also just important to let the team know is like, hey, we're going to take your feedback on a constant basis, and we're going to figure this out together. And part of this is it's evolving and it's very organic, and we're going to have our things that are that work well and things that don't, and we're going to have to pivot. And but we're in this journey together. So I think even stating that up front is we don't have everything solved, because what we're doing today is probably going to be different in 3 months, and it's probably going to be different again in 6 months.
Yeah, transparency. And I think that actually was one of the kind of key components for a lot of organizations successfully handling the pandemic, is they felt okay to say, we don't know yet, but we are working on it.
Yeah. So this next question is, I'm worried we're going to lose a ton in asterisks of employees when employees start going back. Curious to know if this is as a big concern for others, right? So, feel free to chat and chime in, but it does certainly seem like there's a lot of research that says that there's, lack of pent-up mobility because of the pandemic that will mushroom. And there was that Times article on I think YOLO, which you only live once, or some is the, and people having new perspectives on life and thinking that they can work remotely, which opens up other possibilities for them. And I'm just curious, Dr. Voiles, from what you've seen in the popular academic and literature and pieces out there, do you have perspective on that you'd like to share as well?
Yeah, there are a lot of indications that there will be kind of a bit of an exodus as employees see the opportunities coming available again, which I think already is starting to happen. I would suggest that this is a time to survey employees and also for managers to be checking in with their employees to make sure that they are currently satisfied. And this is where your return to work policy is really important as well. I've heard, and this is more anecdotal, but I've heard of employees actually moving out of state during the pandemic. And, when a return to work policy comes into play, that may introduce some complications that may cause them to turn over because they don't live in that state anymore. So organizations will really want to keep the pulse on what employees are doing and how they're feeling as this kind of approaches. It would also be really important to offer, additional kind of flexibility, benefits, and make it hard for them to leave. Make sure that employees, want to stay and that they are satisfied at your organization.
All right. So I think I've got someone prowling outside here. So one real quick point on that is, if you're worried about a ton of people leaving, a couple of best practices that people share with me that I really like is when you're having your weekly or biweekly one-on-ones, make that a topic that the manager talks about, right? Like, hey, how are you feeling? What do you foresee after the pandemic? And just have a very transparent conversation, and maybe the manager can start some vulnerability about where he or she is. And then it's also a great opportunity to have a stay interview, right? This is a very dramatic kind of change and inflection in the company's life cycle. So to also take that as an opportunity to have those candid discussions would be great, because it could be a great move for that employee that should be celebrated to some extent, or there might be additional flexibility that can be unearthed during that conversation. Okay. So the next one is, how do I quantify the impact of our return to work plan? I'm sure you can quantify by happiness or willingness to stay or embeddedness, but I'm curious, Dr. Voiles, how would you think about quantifying the impact of the return to work plan?
I think you need to do it in several different kind of domains. So you certainly want to think about how your employees are feeling. So you want to think about, how they're feeling in terms of the adjustment. This is where you'd want to do a survey and also those kind of feedback sessions to check in with them. Another place would also be to look at employee productivity, as well as, how many employees are turning over. If you notice there's turnover or talk of turnover, that could be an indication that your return to work plan is not so successful. But tracking, for example, performance evaluations would be an effective method. And then finally, just keeping the pulse on how employees are feeling about it, and specifically if there's anything that they need during that transition time.
Great. Okay. And then, okay, I guess this next question from Phil was just about what is P less than 0.05 mean? And then Samantha, thank you. That was a awesome response. So we'll just check that off. But if you have follow-ups, please email Dear Andrew, and we can get back to you. Basically, like whenever we have questions about the data, Dr. Voiles will run that just to make sure it's statistically significant and something that we can hang our hat on versus it's too loose of a correlation. Almost every question we looked at, hey, is there a gender bias? Is there industry influence? Is there anything around size? So we'll slice in many different ways to try to get you the as much signal from the noise of all the data as possible. Okay.
Yeah, and I would say what you saw today was our very trimmed down version because we looked at it in so many different ways. We looked at it by different countries, we looked at it by race, we looked at it by industry, we looked at it by gender. So there were a lot of interesting findings, and we kind of whittled it down to what the key findings would be for you to find today.
So this one is a bit touchy, but we never shy away from it. So let's just dive right in. And they asked, would love to hear from both of you if most employees want us to require vaccines, but if you do not plan to, would you still build a policy to require it? Please share some thoughts and why. And I'll just start. I think first and foremost, part of it depends on the context, right? Are these people frontline? Are they at a receptionist desk greeting guests? Are they trainers in a gym and they have to interact with clients? And part of it is like, what are the client's expectations and what's the expectations of that industry or that role? So I think, some of that certainly takes into place versus like if you're a call center and you can work, at your desk at home or remotely, then that mitigates some of those concerns. But those are some that pop into the top of my mind, and I'm curious what your thoughts would be on that front, Dr. Voiles.
Yeah, I want to make sure I understand the question completely. So are you, the person who asked it, they asked, if most employees are wanting the vaccine to be mandated, but a couple of employees do not want to get the vaccine. Did I understand that correctly?
If I had to interpret, yes. If most employees want it to be required, but some don't plan to get the vaccine, what are your thoughts on that?
Okay, so first I would say that when possible, it's best to just encourage it. People, even just kind of mandating it can also affect not only just the immediate kind of response to the vaccine, but it can affect how employees see your organization, and it can kind of build resentment if they've felt that they've been forced to do something they really didn't want to do. So that's where the things that we promoted before and that a lot of organizations are doing, so like the education, convenience, and incentives. Now, if, as David mentioned, there are some industries where it might really be needed to have a mandate. And SHRM has really great recommendations on this. They even have actually the language to use for a mandate, though they actually discourage it as well unless it's absolutely needed. And also, it's risky to talk directly to those employees about getting the vaccine because that can be seen kind of as a pressure, and also asking intimate kind of health questions where they might be forced to disclose if they have a disability or, for example, if they have a religious objection. So when possible, I would say encourage it. You can actually, there's also a SHRM policy that you can download that just encourages it but does not mandate it. If mandating is required, you can also have other options with those employees who don't want to get that vaccine. So for example, you could offer to kind of change their role or offer different flexibility, or have them work different shifts. Of course, this is something you'd want to be completely transparent with them about and give them a say, because you wouldn't want it to be seen as like a retaliation for them not getting the vaccine. You want them to have control over that decision. But there are options as well, especially if they do have, a religious objection or a disability. And if it gets into that kind of dicey territory, that's where you'll definitely want to consult a legal person so that you can make sure that you have the best advice possible. But when possible, I would say encourage it, don't mandate.
Yeah, and I think that's the kind of the silver lining that I saw when these people leaders like yourselves are more willing to go on vacation to get the vaccine than keep their job, which was also surprising, at least to me. So the next question, or I don't know if it's a question or comment, but thank you, Angel. But your poll was in February and companies are talking about return to work more now. Yes, that is true. And we are going to do a follow-up, I think next month, about very similar insights as well. So if you want to participate and have your voice and your organization's voice heard and see the raw results of where you are, I highly encourage you to participate in that as well. So the next one is Maria. My job of many of the people in my organization requires very heavy travel throughout the US. We have been visiting our customers remotely during the pandemic, but there are a lot of things we cannot do, and we will need to return to the field. What have other organizations done to formulate new travel policies? And then Christy, thank you for, let me just read this. She responded, when we have travel requests from clients, we put it out to the team to see who is comfortable making the trip. We also have agreement with the client that they will take measures to ensure our staff member safety. It's been working while requests have been low, but most of our team is now vaccinated and willing to travel domestically. So thoughts on that?
Yeah, actually, it was that Christine gave that answer. That actually mirrors pretty much what I was going to put as well. One other suggestion I would have is that once you have employees who have traveled, I would say give them a few days just in case if they want to work from home after that, if they have any concerns, just to make sure that they are comfortable. But other than that, I think Christine gave a really excellent answer.
Yeah, Christy, Andrew might be reaching out to you to be part of the next TINYwebinar. That's a great answer. All right. Okay. Given how complicated this seems to be, what kind of starter policy would you suggest so we don't get sued? And Dr. Voyles, you said that SHRM has a really great boilerplate as a starting point. Is that correct?
Yes. They actually have two different versions. They have they have a memo. First, they have a memo that you can send out, and then they have just a policy that encourages the vaccine, and then they have one that mandates it, and you can download those and use those. They also have a ton of information about kind of like what you can do if an employee refuses to get it or what you should do, and a lot of advice that's really great. So I recommend, if you haven't already, you can Google like SHRM COVID-19 vaccine policy, and it pops up with a whole dashboard of really great resources.
Great. And this one is actually very interesting. It's actually at the very bottom. And this person shared, we took a stance to mandate the vaccine. So far, we've had 2 employees who are asking to be exempted, one who works in the office and one virtual. Neither qualifies for exemption under the EEOC's guidelines. However, both employees disclosed medical conditions that we need to have. I definitely would not recommend mandating vaccines unless you are a high-risk essential worker profession. And I think that is in line with what you've been sharing as well.
Yeah, I would agree if you can help it, because it starts to cross a line, as that person kind of mentioned, where employees are going to start disclosing health conditions or concerns that ultimately might bridge the gap between privacy and their kind of health and personal life and their working life.
Yeah, and we do this return to work survey or assessment with a bunch of questions, and I think when we looked at some of the themes, it truly is like people worry about convenience. They worry about, hey, if they get sick, are they going to get PTO? So a lot of it is more incentives, right? That people can offer to hopefully influence if that's the direction and policy that your company wants to undertake. So with that, want to say thank you so much, Dr. Voyles. Thank you everyone for joining us. This is a super important topic, and you folks are just heroes in terms of guiding your company and doing so well through this. And please take a minute to answer the survey question. We are Tiny Pulse, and we strive on that survey so that we can keep improving these TINYwebinars moving forward to give you as much value as possible. Thanks again.